relative importance and values of natality and mortality. And is a subject of demography and hence of epidemiology. We cannot understand the importance, relative importance of chronic diseases if we don't understand the dynamics in each population, which leads to the decreasing values of mortality and the decreasing values of natality, of fertility. And this new picture is called the epidemiological transition, which replies or answers this question: why there are different disease patterns in different populations. As I said, human populations are dynamic, and the changes in mortality are reflected in their size, the relative size. What happens with time, as time passes, mortality decreases and natality also decreases. This gives the following pattern: bigger in previous times, in previous years, and the growth decreases as time passes. The Latin American countries underwent these demographic transitions in the years 2010 to 2015. And the mortality rates and natality rates were modified, and we can put all of our countries in this model and see which are the relations between demographic transition and epidemiological transition. The demographic transition goes first, apparently, and the epidemiological transition goes after the change. Along this model, the better sanitary conditions and nutritional conditions modify the human organism, particularly the immunological human defense system, and they increase by doing so the life expectancy. Life expectancy is the probability of living until X years when a person grows from 0 to 6 years of life expectancy. It's a probability. Phenomena like urbanization also contribute to decreased fertility, and this hence goes as a consequence the increase in older population, and hence giving the substratum for the higher frequency of chronic diseases. There are some we can see more causes of epidemiological transition, but this occurs, the transit between a pattern of infectious diseases to chronic diseases occurs because of the demographic changes that I mentioned, the change of risk factors, the presence of non-infectious agents, the changes in antigenicity, the resistance in microorganisms, changes in lifestyle, physical inactivity, and finally the impact of scientific research by improving the access to early diagnosis. The world population between 1804 to 2011 gives you an idea of the speed of growth around these 200 years. In 1927, we had in the world 2 million inhabitants, having had in 1804 1 billion. So it took 123 years to go from 1 to 2 billion. It took only 33 years for going from 2 billion to 3 billion. And this period is less and less it's shorter as time passes, and the speed appears like that. The only non-catastrophic scenario is what is happening from 2100 because of this increase in size of the population, the world population, but with a lower fertility rate. This is the fact that we are not going to explode in the space by overpopulation of the world. That's the only reason we have. In 1960, the fertility rate was 4.8. Today is 2.1, 4 times less. Finally, we can see the size and shape of the human pyramid, population pyramid, demographic pyramid, which is a consequence of the natality and the mortality relationship. And it is for the developed countries a different pattern than for the developing countries, as follows. In Latin America, in 1950, the size and the shape of the pyramid was, as it appears here, with a very broad base and real pyramid. In 1980, this starts being less important. The lower age groups or younger age groups start decreasing proportionally. In 2010, this goes even further because of the fertility rate is lower, and for 2025 we will have the shape of the demographic structure. In Colombia, we are also undergoing this decreasing in the younger groups and giving the shape of the pyramid approaching the developed countries. The relative distribution of population older than the 60 years is what explains the title of this workshop. Non-communicable diseases are more prevalent in older groups. And the life expectancy is a function in the world of per capita income. Richer countries like Europe, Japan, the United States, and Canada have a longer life expectancy than Latin America or the Central African, Central European countries, and than the African countries. In Latin America, you can see this association. As long as the per capita income increases, so does the life expectancy. And the cardiovascular diseases, cancer and diabetes, are the causes of death in developed countries, and still in developing countries like ours. We have to bear the two burdens, both cardiovascular diseases, cancer and diabetes, and some infectious diseases. The death, proportion of death, 7 first causes in developing countries goes like that. Ischemic heart diseases, cerebrovascular diseases, lung cancer, and some respiratory infections, colon cancer, and diabetes. Whereas in the developing countries, this is practically the same, except for the diarrhea diseases, which are not present in the developing countries. Thank you very much.